understanding prostate cancer, screening treatment options, and managing side effects on HealthSphere. Welcome back to HealthSphere. Today we're discussing prostate cancer, a common cancer affecting men. Understanding the screening process, available treatment options, and their potential side effects is crucial for informed decision-making and better health outcomes. Prostate cancer screening, the PSA test and DRE. Prostate cancer screening aims to detect the disease early, often before symptoms appear, when it may be more treatable. The decision to screen is a personal one and should be discussed with a healthcare provider, considering individual risk factors, age, and overall health. The two most common screening tests are Prostate-Specific Antigen test. This is a blood test that measures the level of PSA, a protein produced by the prostate gland. Small amounts of PSA are normally in the bloodstream. Elevated PSA levels can indicate prostate cancer, but they can also be raised by non-cancerous conditions like an enlarged prostate or prostatitis. A rising PSA level over time can be a more significant indicator than a single high reading. Digital rectal exam. During a DRE, a doctor inserts a gloved, lubricated finger into the rectum to feel the prostate gland for any lumps, hard spots, or changes in size or shape. While less effective than the PSA test for early detection, ADRE can sometimes find cancers in men with normal PSA levels. Guidelines for when to begin and end screening vary between organizations and should be discussed with your doctor. Factors like age, race, and family history of prostate cancer are important considerations. It's important to understand the limitations of screening. An elevated PSA doesn't always mean cancer, leading to potential anxiety and further testing that may not be necessary. Conversely, some men with prostate cancer may have normal PSA levels. Screening can also detect slow-growing cancers that may never cause harm in a man's lifetime, potentially leading to overtreatment and associated side effects. Diagnosing prostate cancer if screening tests are abnormal, further tests are usually performed. This may include imaging tests like MRI and a prostate biopsy. A biopsy involves taking small tissue samples from the prostate to be examined under a microscope by a pathologist. This confirms the presence of cancer, determines its aggressiveness, and helps determine the stage of the cancer. Prostate cancer treatment options. Treatment for prostate cancer depends on several factors, including the stage and grade of the cancer, the patient's age and overall health, and their personal preferences. Treatment goals can range from curing the cancer to managing the disease and its symptoms to maintain quality of life. Key treatment options include active surveillance. This is often recommended for men with low risk, slow-growing prostate cancer that is not causing symptoms. Instead of immediate aggressive treatment, the cancer is closely monitored with regular PSA tests, DREs, and sometimes repeat biopsies and MRIs. The goal is to avoid the potential side effects of treatment while ensuring that if the cancer shows signs of growing or becoming more aggressive, treatment can be initiated. Active surveillance is not doing nothing, but rather a careful monitoring strategy. Surgery. This involves surgically removing the entire prostate gland and sometimes nearby lymph nodes. This can be done through traditional open surgery or minimally invasive techniques like laparoscopical or robotic-assisted surgery, which often result in less pain and quicker recovery. Surgery is a common treatment for localized prostate cancer that is considered curable. Radiation therapy. This uses high-energy rays to kill cancer cells. External beam radiation therapy. Radiation is delivered from a machine outside the body. Newer techniques like intensity-modulated radiation therapy allow for more precise targeting of the prostate, reducing damage to surrounding healthy tissues. Brachytherapy. Radioactive seeds or pellets are placed directly into the prostate gland to deliver a high dose of radiation to the cancer. This can be low-dose rate or high-dose rate. Other treatments for more advanced or aggressive cancers may include hormone therapy, chemotherapy, immunotherapy, and targeted therapies. Potential side effects of treatment. All prostate cancer treatments can have side effects, which vary depending on the type of treatment, the individual patient, and the specific techniques used. Discussing potential side effects with your doctor is essential when choosing a treatment plan. Common side effects include urinary problems, urinary incontinence, difficulty controlling urine leakage. This is more common after surgery, ranging from occasional dribbling to more significant leakage requiring pads. It can also occur after radiation, sometimes developing gradually over time. Urinary urgency, frequency, needing to urinate more often, or feeling a sudden urge to go. This is more common during and after radiation therapy. Erectile dysfunction, difficulty getting or maintaining an erection. This is a common side effect of both surgery and radiation therapy. With surgery, it often occurs immediately and may improve over time. With radiation, it tends to develop more gradually. Nerve-sparing surgical techniques can help preserve erectile function in some men. Various treatments for erectile dysfunction are available. Bowel problems, diarrhea, rectal pain, bleeding, or leakage. These are more common with radiation therapy due to the prostate's proximity to the rectum. They often improve over time, but can be long-lasting in some cases. Fatigue. Feeling very tired is a common side effect of radiation therapy and can also occur after surgery or with other treatments like hormone therapy. Side effects specific to surgery. Risks associated with any major surgery, such as bleeding, infection, blood clots, and reactions to anesthesia. Side effects specific to radiation. Less common side effects can include lymphedema if lymph nodes are treated. Active surveillance side effects. While active surveillance avoids the side effects of surgery or radiation, it can cause anxiety and requires regular medical appointments and potentially repeated biopsies, which carry their own small risks. Conclusion. Prostate cancer is a complex disease, but with increasing awareness, evolving screening strategies, and significant advancements in treatment, the outlook for many men is positive. Understanding the role of screening tests like the PSA and DRE, knowing the various treatment options available, from active surveillance for low-risk disease to surgery and radiation for more aggressive cancers, and being prepared for potential side effects are key steps in navigating a prostate cancer diagnosis. Open communication with your healthcare team is paramount to determine the best approach for your specific situation and manage any side effects effectively. Thank you for joining us on HealthSphere. Stay informed, prioritize your health, and consult with healthcare professionals for personalized medical advice. Disclaimer: this video provides general information and is not a substitute for professional medical advice. Always consult with your doctor for diagnosis, treatment, and personalized recommendations regarding your health situation.